Well, today I kind of wanted to get one to start off with the name, right? So the name of the company is called New Gait, and you guys are doing amazing things to help people improve the way they walk and also just help with many different impairments in regards to neurodegenerative disease as well as car accidents. But I think before we get started with all of the details about what you guys have been doing, I think it's important to discuss what gait actually is, because I think as physical therapists and also people in the space, they understand what gait is, and it's a common term. But I suppose perhaps we can get into the nuance of like exactly what gait is and exactly how New Gait is changing it.
Perfect. Well, our ability to get around, kind of an important goal for most anybody coming into the clinic, is that they want to be able to walk and be independent. And so their independence is their freedom. And to have that ability to continue walking after some sort of injury or disability is huge for the folks that come to see us. And I never considered myself much of a gait expert, but I'll tell you, I sure have watched a lot of people walk via video when I see them come in. I love to get video of their gait pattern. And I love to look at each component because gait happens in such a quick movement. It's hard to capture what are their feet doing, what are their knees doing, what's happening at their hip, what way are they moving through the shoulders, what's their posture and balance and frame look like, in addition to the things that we want to know. Well, what's their walking speed, what's their timed up and go score. So walking, I've been to lectures and been reading that it can be considered the sixth vital sign, that it is so important to understand that walking is linked to our longevity and our joy in life. And so even more important than a heart rate or a temperature, it really is indicative of our ability to be ambulating in our communities and doing the things that bring us value and joy. So to have had the New Gait fall into my lap as such as it did, or sprinkle it onto the mat table before me the first time I ever met it, to be able to then look at how people are moving and how can I influence that in a way that's helpful and meaningful to them. And then to see the result of that through the last 6 years of putting this device on people. And again, studying their movement in the video and looking at their timed up and go scores and looking at their balance scores and looking at their walking speed scores. And so it's been a game changer for me as a therapist.
Componentry wise, as like physical therapists, when we're looking at people, when we think about walking, we look at all the little details. And so for someone who may be just sitting down listening to this, or perhaps is like, I don't know, at the gym listening, when you're walking, there's a lot of different components that make up the way you walk. So even something as small as your toe clearance from when you go from one step to another can really dictate the way that you walk. And so if you're dragging your toe, all of a sudden your body will start to lean one way. So that way you can kind of bring your foot through the swing, if you can imagine. So there's a lot of different components in which physical therapists, as well as other healthcare providers, view walking as a way to try and help people walk. And certainly, especially in injuries such as like multiple sclerosis, where you have neural injury, as well as like a car accident, you see these issues. And so New Gait's kind of working with these patients to build that. And so I guess with New Gait, what are some of the most common abnormalities you're seeing in order to help people improve their walking?
Well, dorsiflexion, that foot drop, is a huge problem for folks, and it might be from a variety of reasons. We've seen it in failed back surgeries where the dorsiflexors just never came back after their surgery. We've seen it in all sorts of different ailments that people come into the clinic with. And once you don't have dorsiflexion and the ability to clear the toe, your body has to, you don't just sit on the couch and wonder, I've lost my ability to clear my toe. I wonder what I'm going to do when I get up to walk. Your body has this innate way to kind of figure that out for you. You might lean a little bit to the left so you can swing your leg through and around to bring the foot forward. We see all sorts of adaptations to try to continue to walk. And some, again, can produce problems in and of themselves over the course of time. And so as a therapist who's primarily seeing patients with chronic persistent pain, those manifestations of gait change can start to affect the other hip or their low back, or some other joint might say, hey, that's not my job. if you just fix that foot over there, maybe I wouldn't have to compensate here anymore. And that's really what the discovery of the new gait has been, is a way to reestablish a more normal gait pattern for people in really just a couple of steps. The dorsiflexion assistance bands go on in a matter of a moment, and then the person's able to walk and they'll say things like, wow, I haven't walked like this in years. So that's been the driving force for what keeps us excited about trying to get the word out on New Gait, is that it can aid gait in a matter of steps in a way that's life changing for someone who's been moving in an abnormal gait pattern.
And Benga, for you,
Yeah.
just overall trying to figure out like the componentry and trying to understand like what people need, I guess, like what does the gait analysis look like, and how did you kind of start by analyzing various ailments to try and build this device?
Yeah, so just to kind of give you a quick overview of how this device came to be. Myself, I am not a physical therapist. I'm not a rehab professional. I'm an engineer, and I have a track and field background. And so I started off by developing a product called the Speedmaker, which is the predecessor to the New Gait. And it was essentially the New Gait, just kind of stripped down to just anterior thigh elastic bands. So bands that would help to resist hip extension, essentially. And so my thinking behind that was, as an athlete, I used to run track and field, and I knew that when I was at my fastest as a sprinter, I had strong hamstrings, strong glutes, strong hip extension motion. And I was coaching a youth track team at the time, and I wanted my kids to also have that same power, because power comes from the hips, and when it comes to sprinting, that's really where you get your power from. So that's kind of where my mentality was in terms of thinking about the product when I first designed it, was how can I improve hip extension power? And from that, it was just simply a quite a simple device with a shoulder harness, waist belt, and 2 leg straps on the above the knees, and then elastic bands that went from right above the knees on those leg straps up to the waist. And that was it. And then, as Cathy had mentioned, this device got into the hands of one of her colleagues, and from there, she started using it on spinal cord patient, and really started tweaking around and playing with the placements of the elastic bands to help accomplish other things other than hip extension resistance. So in the rehabilitation and physical therapy aspect of it, it's providing both resistance, but then also assistance to certain muscle groups. Because as we know, the running motion is a lot different than walking, and muscle activation differs between a sprinter and somebody who's walking, much less walking to try and recover their gait. And so it's been really incredible to see the development of the product from the Speedmaker and much more simple device to what it is now, the New Gait, which allows for assistance or resistance in a multitude of different planes for a multitude of different muscle groups or tendons. And so it's pretty incredible to see just how the product has evolved from the Speed product to what it is today.
And I suppose prior to the initial genesis of the Speed product and also the New Gait, were there other devices that existed that you're like, this isn't helpful, this isn't like superior, I could definitely make something better than this?
Yeah, there were, there's obviously the parachute, which is a pretty popular sprint training tool. And then there's this other sort of device that has 2 leg straps right above the knees, and then essentially elastic bands that connect to those leg straps. And so it provides resistance, but it really messes up your actual running gait, your running pattern. And so I wasn't a big fan of that, and I really wanted to develop something that would complement a sprinter's running gait versus impede on it and just provide resistance for the sake of providing resistance in an unnatural form. And so that was really my thinking behind the Speedmaker. Was I want to not just provide resistance for the sake of providing resistance, but I wanted it to complement the natural way that the body moves and the natural way that a sprinter moves without impeding on any other natural movements.
Interesting. And then Cathy, I guess on the side of rehab for other devices that prior to New Gait, what existed that helped people perhaps change the way they walked for ailments such as MS or like spinal cord injuries?
Well, we had, of course, the assistive device such as your Lostran crutches or your walkers, and AFOs was primarily the knowledge base I had on options for people that had gait abnormality. And so I hadn't really realized there was TheraBands too. We used to try to lift toes with TheraBands or ACE wraps, but that was the extent of my, gee, what other tools can I bring into the clinic here to help modulate this gait that someone's going to be able to use at home or out in the community. And they're really, other than an AFO or again, some sort of walking frame or stand assist, there really wasn't a lot out there that I had known about at that time.
Interesting. And so, for those listening who have not seen the device, this is kind of almost like an exoskeleton that provides assistance with many different parts of the way you walk. And I guess, Benga, how would you describe the device for those who are maybe just listening in the most simple terms? And how would you feel that it would be helpful for people who perhaps have issues with maybe drop foot or other ailments?
Yeah, so we kind of describe it as a soft wearable harness system that provides elastic resistance. So it is similar to an exoskeleton device where it is, sort of like a suit that you put on, but it's very different where it isn't powered. And so the only sort of mechanical assistance you're getting from the product are with elastic bands. And so this particular device does not, stand somebody up, using motors or anything. And so it really forces the person to have to work. And so it really becomes a rehabilitative device. And one of the biggest benefits of our device versus some of the other competitors out there is that we've gotten a lot of positive feedback, particularly from the foot drop assist. So with a lot of patients, the standard of care for foot drop is an AFO. Slap an AFO on it. There's different varieties made of different materials, but primarily they're all pretty much the same. And lots of patients don't like their AFOs. They're uncomfortable. They don't allow them to actually flex their foot in most cases, and that then leads to atrophy and whatnot. And so with our device, particularly just this foot drop device that we're talking about, it allows for an individual to both help clear the toe, but then also allows for full range of motion in the ankle joint. And so while you're getting dorsiflexion assistance, you're also allowed to plantar flexion and move your ankle in all ranges of motion. Not to mention that it's way more affordable than your typical higher end AFO that might be comparable to this. But the device is actually so much more than even just that particular component. With the entire suit, you can do so much, and we are working on getting some research done to really figure out the nuances behind what's going on. But what we can tell you is that there are just a wide variety of different use cases for the device, where it's helping folks with a variety of different neurological conditions, from spinal cord injury to traumatic brain injury to multiple sclerosis to ataxia to orthopedic issues such as knee replacements and hip replacements, and just severe trauma due to car accident or some other type of accident, to even chronic pain. And that's been just a really incredible journey that Cathy's been on, particularly where she's the chronic pain expert in her town. And story after story of just individuals who have been assisted, who have chronic persistent pain who Cathy's put this device on, and it just seems to calm their pain. And so when people look at what the New Gait is, it's more than just, you know, a neuro device that's, you know, promoting neuromuscular reeducation, or it's more than just a biomechanical device or an ortho device that is providing resistance or assistance to muscle groups. It's doing more than just that, because, you know, how do you explain someone who has chronic pain for the past decade, put the New Gait on and then be relieved of their pain? There's a lot more going on that we're still in the very, you know, infancy stages of finding out what exactly is really the underlying, you know, scientific reasons for what the device is doing.
Certainly. And I mean, I talked to Cathy prior to, and I think one thing that we want to highlight also is this chronic pain issue. And I suppose, Cathy, what have you seen in regards to chronic pain patient success and things of that nature? I know chronic pain is kind of it's a difficult topic to navigate just because there's so many different aspects of it, right? When we talk about chronic pain, there's pain management, there's medications, there's exercise, there's so many different factors that go into it. So I suppose let's paint a picture in regards to like how you've been helping chronic pain patients before and how you're using the New Gait to assist patients now.
Well, in my work with those with chronic pain, they tend to view their body sometimes as a bit of an enemy, and not so much seeing it as, yes, there is a pain aspect, but there's also more. Like there's more of their body that they can focus on around that pain. And so we would focus on doing exercises where we're thinking about, what do we feel? Yes, we have the complainers, but what do we feel in those guys who aren't complaining? You know, what does your ankle say today? What does your knee say today? How can we communicate with our body in a different manner than what we might have done before? So as a clinician, I like to work with people with their self-image and their body awareness. And so I like for them to know that they have the body parts that want their attention and love to complain, but there's also body parts that we can think about and focus on and talk to try to use as a distraction and to try to feel our body in other ways than we might have been when we're so focused on our pain. And so the New Gait gave people a different sense, it seems, of their body, in that suddenly they felt they were standing taller, they were standing more confidently. And in that change in their sense of self-awareness, it seemed that provided a calming sensation to their pain response, their sensation of pain. And it was often and is often immediate. I can't other than assume that there's a joint congruence that the body's responding to. There's something about the deep pressure sensation that the New Gait provides to them, in that their nervous system is sensing to be a green light. For instance, folks with fibromyalgia, those folks have a lot of chronic constant pain. And when they would wear the New Gait, they would report their pain either to decrease significantly or be gone. And it would allow them to move with a different gait pattern than the one that they had arrived with 10 minutes earlier in that day. And the ability of the suit then, once it's removed, for that person to have a different sense of themselves, oftentimes they would be able to leave the clinic then with much less pain. And so they would enjoy wearing the New Gait device. Some obtained it for home use, and they found that was very comforting for spinal conditions. And by putting them into the New Gait as well, there was something that they found very comfortable, very relieving of their symptom as soon as the suit was put on. So many people will obtain, again, a unit for home. They can wear it. They can go out and do the things that they weren't able to do. And it allows them to know that perhaps there is a different place within them that they can find to go to have symptom relief that they hadn't experienced or explored before.
And Benga, when you were kind of developing this device, were you trying to, Cathy's kind of painting this picture of bringing them back. They're obviously covering many topics within the chronic pain community. However, when you were developing the device, was there an attempt to bring the joints back to alignment? I guess, was there like a framework in which you're trying to achieve when you're developing the device, so that way people can get back to almost like a baseline, so that way they can start moving again?
When I developed the device, that was not the intention. But certainly once we started to redevelop, so when it was developed for SpeedMaker, that was not the intention. But when we were redeveloping the device for the New Gait, that was certainly something that my clinical team kind of put into consideration and really thought about. Because when you're looking at athletes and sports performance, that's one thing. But when you're looking at just basic rehab for somebody with MS or spinal cord injury, then that's a completely different thing. And there was definitely a concerted effort to not just, as I said before, not just provide targeted assistance or resistance, but to also, yes, put the body into proper alignment. And that's important both for improving gait, but then also for, as Cathy mentioned, for chronic pain, because a lot of times your pain can be associated with your posture, and so if you're then able to put the limbs into proper alignment, thereby improving your posture, you can help to relieve pain, but then also walk better.
And I guess the question for me that I find interesting is that, why can this be used as a device to help people move when exercise can do something similar, right? It's like, as PTs, we can do exercise and try to correct it, but it seems like New Gait is almost a bridging tool to get people back to where they were before. Because sometimes people have a bad relationship with exercise because movement hurts. And so I suppose, as you've been using New Gait and you've been finding some of these testimonials, have you found that New Gait is something as a progression tool, or is it perhaps a device that you can be used for long term, or both?
So it's a little bit of both. I'll start off, and then Cathy, you can jump in. But it's a little bit of both. And what the New Gait, one of the biggest things that the New Gait does is that it helps people walk easier. And so when you have somebody who, yes, has a bad relationship with exercise, and for some people, just getting up and walking is exercise, and that's a struggle and that's a pain. And so for somebody who it's extremely painful to just get up and walk, how often do you think they're going to walk?
Right.
Not very often. And so for the New Gait, what our device is able to do is make it easier for them to walk, whether they have pain while they're walking or whether they just get out of breath and become exhausted and can't walk far. The New Gait makes it easier. So therefore, psychologically, it's then easier for them to get up and walk. And once they start down that cycle, then they're walking even more and more, and then they're just building their endurance and improving their health and so on and so forth.
Walking is the best aerobic exercise. Our brains love to get out there and explore our world. And so if you can take someone that couldn't walk 10 minutes and now they can walk up to an hour, you've not only increased their fitness, their cardiovascular capacity. The world rocks when you can walk. So it's a huge tool for many people who haven't been able to see themselves as someone who can get out there and go. And that's what we found, is they can get out and go. And some people, just use it for a few visits in the clinic. It's as if they have a motor planning reset and then they don't need it anymore. And then others say, hey, I'd love to get one of these for home, which builds on that short-term neuroplastic change over time. That movement gait quality is so improved for them in the unit, they can keep practicing. And so
a friend of mine had obtained a unit for home. She has a history of degenerative spine disease. And so also with that, she's had a problem with her ankle instability and falling. So she had gotten a unit. And as soon as she put the shoulder harness on, she loved the sensation. She loved the stability. She loved the support that the unit provided to her. Then she had started a walking program with it every night after work. So she'd walk about 20 minutes. And she did that for a couple of months. And all of a sudden she says, I'm not having that back pain or instability anymore when I head out to the barn through the snow to go out to see the horses. I'm not falling down. So she wore it for a bit more and said, hey, I'm good. I'll set it aside for the time being. Well, last summer then something happened. She started to have a little back pain once again. She put herself back in the New Gait, started walking with it after work again. And then she's back to not falling down, not having pain. So for her, it's been a game changer. She really finds the comfort of the unit to be very supportive, and she just loves that sensation. And then she's able to carry that with her when she's not using it for a period of time. And that's been true of, again, many people who report back to us that I was doing really great with it and I'm still doing well. I don't need it so much anymore. We had one client who was wearing it 8 hours a day, and she found tremendous pain relief. She was unable to walk or stand or sit for any amount of time without pain. And she then now said 2 months later, I'm down to wearing it 4 hours a day to get the same amount of pain relief, but I can walk. She's been able to participate in a walking program to lose weight. She was able to walk through the airport at the holidays to catch her next flight and didn't need a wheelchair. That was huge independence and huge freedom for her. So we never know until we put it on someone what kind of effect they're going to have. And when they have that kind of report to us, we know we've done the right thing, and it keeps us moving forward.
Well, certainly it provides a physical change, right? I mean, you have these elastic bands and you have this harness and you have this whole structure and exoskeleton, like we described, that allows for people to sustain a posture, or at least sustain a walking pattern that allows them to do what they're supposed to do. But I suppose psychologically it has to provide so much relief. I mean, having the sensation of like being bound to a wheelchair or bound to a walker, and then all of a sudden saying like, I no longer need this, or perhaps there's opportunities throughout the day for me to walk more than I used to, has to be a huge game changer. And I suppose, have you seen more of a psychological change, a physical change? Is a combination of both, I guess? Like, what is the most empowering part have you seen with use of the New Gait?
Totally both. I mean, just the psychological, oh my gosh, I can. You know, we live in that I can't world. I haven't been able to. I don't see myself ever being able to do that again. And all of a sudden you put them in a New Gait and they go, wow, look at me walk. The smiles, the tears, it's just overwhelming sometimes to have someone feel they can be and do something they never envisioned themselves doing or being 5 minutes before you put them in it. So that, again, it's a combination truly of both.
And how do you determine when you should use it, I guess? Sorry, Benga, you can go ahead.
Oh, yeah. So I was just going to add that what the New Gait is doing is, you know, for me, not being a physical therapist or rehab professional, you know, my eyes aren't as attuned to, you know, the specific nuances of gait. But what I can tell you is, you know, the overall feeling that patients get when they're able to walk better. And, you know, it's much more than about, you know, improving your walking speed, you know, 1 meter per second, or, you know, doing the tug test faster, or any of those sort of clinical evaluation metrics, more so than it is about, you know, hearing the patient stories of, you know, now I got to go to the grocery store on my own. You know, now I got to walk through the airport without having to get wheeled around. You know, now I can climb those stairs that I couldn't before. Like, those are the outcomes that really make a difference, and that are really just kind of life-changing. And so those are really the biggest differentiators that we see with people who are using the New Gait. And those are really the stories that we love to hear.
Yeah, I was going to say, and like a lot of those things are almost taken for granted, right? The ability to walk upstairs, the ability to walk for a long period of time, the ability to go to the grocery store on your own and just like go grocery shopping. I know for me, sometimes I don't want to go to the grocery store, but perhaps thinking in terms of like, well, at least I can do it, right? You know, and I think it's empowering, and psychologically, physically, it provides so much. But I suppose, you know, what are the criteria, I guess? What are you looking for, Cathy, when someone comes in the clinic and you're like, is this going to be a good candidate? Is this somebody who's not going to be a good candidate? I suppose, you know, you said that you're like, well, let's try it and see. I guess, what are the factors that you're looking for that will perhaps indicate whether or not you'll find success?
Again, sometimes I'm pretty certain right off the bat when I see someone come in with a walking pattern that's very labored, you know, and I think, wow, I bet if I just got some dorsiflexion on them, they'd feel a lot better. You know, you're watching them come through when you're taking them to your treatment room, and you can see how slow they're walking. You can see that lateral trunk sway. You can hear the foot scuff on the floor. You can see how they're compensating, you know, to move those limbs. And so oftentimes I'm just clutching my hands together, rubbing them, going, oh, wait till you see what I have to try on you. And then there are people who come in too, and I think, well, they look like they're moving pretty well. I'm not really seeing any real gross abnormalities here. But when I put it on them, because I just oftentimes, because it's a chronic pain condition, when I'm seeing them, if I put it on them, I want to know, what is their nervous system going to give us a report of? Is it going to say, wow, I like this, I can feel different, I can move different? Or maybe it's just like ain't no big deal, I'm not really feeling it. It's just, not making much of a difference to me today. But, you know, I have people then tell me things like, I feel suddenly as if my legs are connected to my body. Well, you didn't look to me 5 seconds ago like you were someone who was moving like your legs weren't connected to your body. Where does that come from? Why are you telling me now that you can feel your feet? You know, when I watched you walk in, you didn't look like you were having a problem with that, but now you're telling me that. And they say it in a way that's enlightened, like, wow, I can feel my feet, I can feel my legs, I can feel like I'm moving with stability and purpose, as if I know where I'm now putting my limbs, where I wasn't a moment ago. You know, when we think of pediatric therapy, both OT and PT, we work a lot on joint congruence and body awareness and sense of self. And I think, well, what happens to those people who grow to be adults? Maybe, you know, there's a spectrum of some of us who just really aren't very body in tune. And maybe the new gait is helping us diagnostically find and connect to those people. So often I wouldn't dismiss the device's use because someone might not have a gait abnormality, but certainly when it was related to painful condition or inability to do something that was of value to them, by putting it on and giving their nervous system a different stabilization and sense of support, we might have that kind of breakthrough moment, that breakthrough sensation. And I never know it then until I try. I mean, I don't know when I look at someone who's in there, who is going to connect with me through this device of elastic bands. I mean, it's just an amazing, profound thing as a clinician. So I don't know if that answered your question in a way that was meaningful, but I just was so taken by people's responses, whether they came in for shoulder pain or neck pain or thoracic pain, you know, by giving them a different alignment and movement, it seemed to change for them in a way that they found very positive and comfortable.
Yeah, and it's important to know that not everyone's gait is, but everyone walks differently, right? There's so many different nuances to gait, and you can, I mean, the whole study of biokinetics and biomechanics is just a study of gait or walking rather. And, you know, you can literally dive down a whole rabbit hole of analyzing how somebody walks, but certainly, you know, making that judgment call, I'm assuming, just becomes a practice and being able to analyze, you know, the way people walking and figuring out, you know, your population, because it seems like you're primarily seeing many chronic pain patients as well as just patients who are generally perhaps have ailments such as MS or chronic pain and multiple sclerosis or cardiovascular accidents. So it seems like you're having success in that realm. But I suppose for you, Benga, in regards to data collection, I guess, like, what are some of the key components that you're trying to collect as Cathy's seeing success and like seeing all these like stories? I guess, what are some of the things that you're gathering to show like this is what's making it successful? These are the benefits that we're seeing with this device.
Yeah. So as far as the sort of the data or the stories that we've collected so far, we have, you know, probably over 24 stories on our website and on our YouTube page of just patient testimonials explaining what the new gait has done for them before and after. And so we're continuing to sort of collect those stories because when it comes to patients and they really want to see, you know, how has this helped on another patient, you know, like me. And so those stories are huge for other patients to really believe and buy in and really take a chance on the product. On the clinical side of things, we're really working on trying to establish some university relationships to study the product from, obviously a more scientific and a more research based standpoint, to really understand what the device is doing, and to get some more data behind that, and to get a published study that says, hey, the new gait can, X, Y, and Z, whether that's increase walking speed, reduce rate of perceived exertion, improve, some sort of balance characteristic. And so we have some initial data. We've had a pilot study done on the multiple sclerosis population, but to date, we do not yet have any published studies. And so we're working on getting some sort of published study that kind of proves what we've already seen with the product.
Yeah, and I suppose, Cathy, what is the importance in the side of clinical? Like, why is walking speed so important, and why are you guys emphasizing this as a metric to help improve patient outcomes?
Well, walking speed, again, is indicative of our ability to have balance and be strong and keep us away from other types of illness that come along with being sedentary. It allows us to achieve the tasks that we want to achieve. And of course, we want to reduce the risks of falls. As we age, falling is not something that's going to be beneficial to any of us. And so the stronger we are when we walk, the less likely we are to fall. And that's huge in a therapy realm, because we don't want to see those people back for their broken hips if we could have done all we could to keep them strong and moving to prevent that in the first place. So walking clinically is really important to me as a clinician. And a lot of people don't have access to cardiovascular equipment or facilities. We live in a very rural place here in Michigan. And so to be able to walk or to go someplace to walk is really important and huge for them, because that's their cardio. And so sometimes we forget how important walking cardio is. And so to allow them to get out to the mall or get out to a place where they can walk and walk safely and work on that fitness is very essential for these folks. And we know that in managing chronic pain, cardiovascular activity is a driver. It releases all those endorphins and makes us feel so much better and productive. So to me, it's a win-win to be able to get somebody up and walking again.
Yeah, and in my mind, immediately went to like cost savings, right? Because I mean, one of the biggest leading causes of death is falls, believe it or not. And if you can prevent that with a device and prevent ongoing medical costs for years to come, I mean, I can only imagine some of the cost benefit analysis of that. And I suppose, are you guys looking on the side of perhaps analyzing like the cost to benefit ratio, or perhaps the adjunct of using New Gait with somebody who has perhaps fallen and has used it, and maybe their time to recovery and perhaps their overall quality of life?
We are in the process of looking at all of that. What's their qualitative, what's changed for them being able to get into the New Gait. And so we've got all sorts of ideas. We're still working with researchers at universities. If you happen to be one or know one that want to partner us up, we're game. So please give a call. So we want to understand how this works, why this works, and in what manner it's working, and what makes it a great tool for the rehab professional. And the more answers we can, right now we got tons of questions and I got tons of research ideas.
And overall for, I guess, coverage, I'm assuming insurance may not cover this at this moment in time, but I'm assuming the goal overall to perhaps see that perhaps Medicare can cover for patients who may not be able to afford and or may need it because of certain financial situations.
Benga, I'll let you take that.
Yeah. So we've made a really concerted effort to price this particular product at a lower price point than what is currently out there and what is currently being designed and engineered. So the big trend in our space is really to go high tech. So whether it is high tech FES device or some sort of powered exoskeleton, these are the devices that are being produced, and they're not really getting any cheaper. And so we've made a very concerted effort to say, hey, there's there is a gap in the market in terms of effective products that improve people's, gait outcomes, and we want to fill that. And so we've really made sure to be on a price point that the average individual can be able to afford. Because when you look at it, we're not just a device with some straps and bungee cords. We're giving people hope. We're giving them the ability to have independence again, to be able to to do things that they haven't been able to do in years. And so, is that worth a few $100s for you? Maybe not. Is it worth $80,000 for an exoskeleton? That might put you under.
Yeah, right. It might be a harder pitch.
So it might be worth it, but if you got to go bankrupt, then that's a different story. And so yeah, we've made sure to make our product very, very cost effective. However, we are looking at ways to make it covered by, or to get it covered by insurance, both Medicare and private insurance. And so that's more of a long-term strategy to be able to go down that route. But in the meantime, we feel that we have a very cost-effective product that is more than worth its weight in gold in terms of what it's able to do and the outcomes that are that are able to be achieved in it.
Well, certainly that was the first thing I thought of when I went to your guys' website and was just kind of scouring around all your patient successes. I immediately thought of all the people in work in robotics trying to build these like giant exoskeletons that are like make you look like a human transformer. And I'm just like, this is just so much easier. It's much more simple. It's, and it's easy for you to see, right? You can be like, okay, the cord or the apparatus is helping me do this. And I can do that versus like, I have to put this technology on. I got to figure out how to use it. And, something can break. Whereas this, if something were to break, I'm assuming that the replacement cost is significantly less than replacing like a whole arm or a chip or something of that nature.
Absolutely. Yeah. And it may not be as cool and sexy as those other devices, but it works. It gets the job done. And it's very intuitive, from a clinical standpoint. It's extremely intuitive in terms of the elastic bands. They're essentially just muscles and tendons. And so you put those where you want to. This person has weak hip flexors, you add a hip flexion band, and so it's very intuitive to see how it works and to understand what it's doing as well as being cost effective.
Is there a goal to perhaps even add, like as devices come out, even like wearables become a little bit more affordable for the average population? Is the goal to perhaps encapsulate or add on additional information so people can benefit and see like the type of progress they're making, perhaps maybe like force generation, like, okay, now we're using 10 pounds of force versus 20 pounds, or perhaps like a walking counter within the device, I suppose. I wasn't sure if you guys had traveled down that route of using wearable technology within the device itself.
Absolutely. Yeah. We've discussed it, and it's definitely within our product roadmap where we want to be able to incorporate sensors into the device so that then we can start generating some data, in terms of their gait and how they're progressing. What is their walking speed look like now? What did it look like before? What is their step length? What is their step width? Data such as that would be helpful for both the patient, but also the provider, whether it's the physical therapist or the physician. They're going to want to know that, especially as reimbursement is moving towards outcomes-based payment structures. And so, with that movement, people want to know, is therapy working? Is this working? And so by incorporating some sort of outcomes-based collection system, automated, then that will help to auto-generate some of that type of data to help back up claims.
And certainly, for people who may not understand, it's just that in order for New Gait or other companies to show in rehab that the device is working, you need to make it objective, and objective can be translated over to things such as like walking speed, like he's talking about, or going up and down stairs, or the patient is able to demonstrate the ability to get up out of a chair more easily, or whatever your objective measure may be. And I suppose, Cathy, are you using that as a way to kind of measure objectively, like how patients are improving, whether it's, a timed up and go, whether it's a sit to stand, I guess, are those some of the things that you're using to make it objective for all your patients?
All of those, and especially what's improved for you at home. So for my client who couldn't walk from the car into the church, like knew I could walk so many steps and that's it. And then I had to sit. Now he's walking up to the choir loft. I mean, crawling, not having to crawl up the stairs anymore, walking like a normal person, wearing the new gait underneath his robe every time he went in to do the choir. And so that's pretty huge. That's pretty life-changing. That's what this is all about. And, for objective measures, the walking speeds, you can see it. You can see the changes in body dynamic. They're not any longer this lateral trunk sway side to side. They've got trunk rotation and arm swing. And so the things that are so exciting to me about this is I can give someone dorsiflexion. I can give someone plantar flexion. So imagine, one of my favorite things to do is to emulate someone's gait. Like I would videotape it and then I would analyze it and then I would try to emulate it. And then I would think, okay, if I have no toe off, how is that? What does that feel like? As best I could, try to feel what they're feeling. Well, if I give them toe off, suddenly I'm not hyperextending my back to try to swing my leg through anymore. Well, that's huge. There's no other device out there that I know that can give you gastroc power in a step. And so when you restore that for someone, you've changed the way they move completely. You've given them knee flexion, increase in swing. You can control step width. You can control hip flexion assistance. You can control whether or not you want more knee extension at heel strike or whether you don't want that knee hyperextension at mid stance. So you can control all those little variables. And the cool thing about this bands are, you put them on and you go, well, that didn't work. Let's put it over here. You move it half an inch and all of a sudden they go, oh yeah, that's way more comfortable than where you had it a second ago. I mean, you're working with your patient to build for them the best movement and comfort. And that's what's so fun about it. And then once you start playing with that, your eye gets better at it. And it just is very exciting to have that tool to really change the way this person's feeling themselves, seeing themselves move. It's an amazing device to give a try to.
And you mentioned comfort, I guess, and we're also talking about just like the clunkiness of like an exoskeleton for like the technology, I suppose. What are patients saying in regards to comfort level? And I guess, are they comfortable wearing it out in the public and, wearing it underneath clothes? Is this something that's kind of, aesthetically pleasing, or at least at the very least comfortable, so patients can use it for a long period of time? Because I've seen a couple people who wear like braces and, it cuts right into them. And I guess, was that something that you guys had considered and worked on as you were building the device?
Absolutely. We didn't want any portion of this to be uncomfortable, because then that throws up the red light. And so we have to stop and fix it. And that's what we've been able to do as we've tweaked this thing over the last few years, is to really find all of the attachment points that they have comfort on the limbs and they don't bother you. And so patients, it's an amazing thing to have someone tell me they just wore it through the airport, when the TSA person says to them, well, I've seen a lot of devices come through, but I haven't seen that one yet. Yeah, well, look what it can make me do. I can walk. I don't need your wheelchair and I don't have any pain. So patients will wear it. They'll say, I was out on the bike path today in my outfit and I had 2 or 3 people stop and say, what is that you have on there? And so I feel, as someone using this, that if I'm able to share that and if I can help someone find benefit in this like I have, people are all about wearing it out and letting people ask, and then offering that information to them when they ask. And yeah, there are a couple folks who don't want to be caught in public, but hey, you can always find someplace kind of off the beaten path to go and walk. So you have options. Long skirts will cover over the lower portions if that's not something that's comfortable for you. But it's an amazing thing how comfortable people are in it, out in public and out doing the things that they value.
And for some of the ones who don't want to wear it in public, this device is also sometimes used as just an exercise tool, exercise device. So, some people use it just, maybe half an hour a day just to exercise. And then, that's it. And so for certain people, who don't want to be caught outside with it, they can wear it inside, wear it indoors, and get their walking in, and then that's their exercise, and then they're good. And so it's versatile. It varies in terms of how often an individual needs to wear it and wants to wear it, and so it can accommodate for a wide variety of different types of people.
Yeah, great point. And I was just going to say that, and like, for people who are using it as just an exercise, it's a great way to bridge the gap between just not being able to move at all and just getting started and getting moving. And I guess my goal as a physical therapist, obviously, is to get people back to a exercise program. And I suppose the goal of the New Gait is to get somebody to sustain an exercise program for the long term. And I guess, have you found people using it more of, again, as a bridging tool to an exercise program to maintain that long-term goal? Or are they using it just like for everything, so to speak, where they're, even from the time they get up to the time they go to bed, they're using it? I guess, is there a big piece on education and saying like, this is going to be a great tool for you to be continuing on to walking and doing all the things you want to do, but my goal for you ultimately is to get you back to an exercise program so you can sustain all these newfound improvements that you've gotten? And so I guess, is that what you're trying to do with all your patients, perhaps, that are able to try and get to an exercise independence, so to speak?
Absolutely. To instill in them a desire to exercise when we know how healthy it is for us to do that, and how many barriers we can set up for ourselves to not do that. So to give someone the ability to either find comfort in doing it within the New Gait components, or at least using the New Gait to bridge the experience of becoming strong enough so they feel they can wean from it then and continue with that lifelong exercise, because it certainly is the elixir that keeps us moving and alive. So that's ultimately the goal. Whatever way we can get them there, if the New Gait will help them, we're on it.
And I guess on the side of like taking it on and off, I know sometimes patients who maybe had a spinal cord injury or even MS, they have limitations in range of motion significantly. And so I suppose, have you found difficulties with some patients putting it on and off, or is it fairly easy to use and fairly straightforward in regards to taking it on and off?
We did have some people who I was rather surprised by. I thought, well, they're a little stiff in their movements. I'm not sure how this is going to go for them, but I am just amazed. They can sit down and put it on themselves. And so once they're in, it just is amazing how comfortable they become doing that. And then we've had a couple individuals who might have had some sort of limitation within their hand dexterity, that they might need some help from family members to do it. And of course, if they're living alone, well, every individual has their needs, right? So we might have to offer some sort of special accommodation for the unit to make it something that they can get into and out of by themselves. So we really try not to have barriers for use. If someone's having a problem, ultimately all they have to do is let us know what that problem is, and we'll brainstorm with them and problem solve with them to try to figure a way to make it doable.
And I guess, Benga, on the side of design, are there perhaps attachments that you've thought of, or perhaps are in the works of doing, to make it easier for, perhaps, like she had alluded to, where there's like hand dexterity issues or patients who have grip strength issues? Are they working on that side to make it perhaps ease of use better?
Yeah, absolutely. I mean, actually, in our last team meeting, we were talking about our new design, and so we're not just kind of resting on our laurels and on our current design, but we're always in the process of product development. So we have an orthotist and prosthetist on the team who's been really influential in redesigning our device. And so we already have a new design that we've got in the works, that we're kind of putting out some prototype units out there just to get some patient feedback and some clinical feedback. And so this will help alleviate some of the issues that we've heard about in previous versions of the product. And so we're always working on making it easier to use, easier to don, and more user friendly in general.
And certainly hearing that you guys have a team behind you working on all these different components. I mean, between Cathy and I'm sure the orthotists and everybody, you guys have more ideas than you could probably manage, and trying to figure out like, okay, what is the most important thing? Let's focus on this first, and then let's move forward. Absolutely.
And we've been really blessed to have a really great clinical team, which has allowed us to get almost immediate feedback on new ideas, new designs immediately from both the clinical aspect as well as from the patient aspect. So one of the big things with our product and New Gait in general is that we have a huge focus on being clinical friendly. So essentially, physical therapist friendly, where we want to make sure that whatever we develop is easy to use for the clinician in the clinic, as well as for the patient at home. And so by having a clinical team that's so close to the product development, we're able to rapidly iterate on product feedback and improve upon the product.
And certainly I can imagine PTs are kind of at the forefront in regards to use, and orthotists, so to speak, but I suppose are there other disciplines that have benefited from use of the device?
Occupational therapists.
Mm-hmm.
We have some that are using it as well within their clinics. It provides standing stability when they're doing upper extremity tasks. It allows them when they're doing their functional things within their simulations within their kitchen. It gives, again, someone better stability and support to be able to move within those environments. So we've had OTs using it as well.
And yeah, and to
go ahead.
To kind of piggyback off of that, we've got some OTs using it, and they've been extremely inventive with it, and have kind of jerry-rigged the product to help with upper extremities as well. And so as a result of that, we're also working on creating some custom designed upper extremity attachments that can help specifically for OTs.
Now I know some medical devices you can really deck out. Are there going to be some decked out options where we can make like a green suit or a blue suit for people who want to make it individual, or is that a little bit too far on the horizon?
Possibly. That, I mean,
okay.
that, yeah. I never say never, right?
Never say never, right? Exactly. Well, I guess how can people find out more about the New Gait? I guess like if I am a clinician right now thinking like this New Gait's going to be great for my patient caseload, I think this is going to be something that's going to change the way that I do rehab. I guess what is the typical process, and like how can people go about getting a device?
Check out our website. So we're online at thenewgait.com, and obviously that's Gait, Gait. And check us out online. Please check out our patient stories. So we have a ton of patient stories on our website as well as on our YouTube page. And that really gives you a sense of what the product can do and who it's for. In addition, we offer a free 30-day, no risk clinic trial. So we will, if you're a clinician, we'll allow you to borrow a unit for 30 days. Risk-free, we'll even pay the shipping back, and you essentially get an opportunity to try it out, and we encourage you to try it on any and every patient you've got. So like Cathy mentioned, it can be used on so many different types of patients. And one of the, I know Cathy will tell you, one of the most frustrating things is when a clinician says, I didn't have the right patient for it. And there is no one right patient. We just named, a dozen different diagnoses where the New Gait can be used on. And so please check us out. On our website, we've got a link where you can request your free unit. And again, that's a free 30-day trial, risk-free. And it gives you an opportunity to use it in your clinical setting and just give it a shot and see if it works out for you.
And we have training online. You can Zoom with us. We're available anytime to ask questions. We're just really here to help and make this be successful for both you and your patients. One other option is if you have a patient that wants to give it a try, they can order a unit. We send it to the patient, and then that patient will bring it to therapy, and you two together can explore the best combinations for the device. So we will get it to you one way or another.
Can a patient order it for themselves and or perhaps for a family member? And if so, how do they go about doing that?
So we don't typically allow for a patient to just go on the website and order it blindly, because there is a level of customization required. And so we always require that a patient is either one, working with a clinician who already has a unit, or they work with their clinician in conjunction. So, if they reach out to us and for one reason or another, the clinician says, I don't want to, I don't want to do the trial, but if you bring it in, I'll work with you. Then we're willing to work with that patient. But just because of the customization part of the unit, it isn't something that a patient is just going to be able to pick up and understand, with the one exception of the foot drop assist. So, the dorsiflexion assist or foot drop assist kit that we offer is pretty self-explanatory. It's very, very easy. It just is one elastic band that, goes from below the knee down to the foot. And so for that, we allow for patients to purchase on their own. But the rest of the device, it does require clinical intervention.
And go ahead, Cathy.
One other thing I'd like to add is if you're a clinician that's using suspended ceiling systems for ambulation, if you've got the light gait style treadmill suspension system, if you have somebody who's been doing robotics and is now going to transition to overground walking, that's where I think the new Gait has a huge value to you to help make that transition be even more productive, because you can control so many parameters of gait, both when they're suspended and when they're then making that transition to overground. So that's another huge use of the device that I would like to see more clinicians obtain a unit to give a go with.
Excellent. Well, we're closing in up on the hour here, and I really appreciate both of you taking so much time out of your schedule to come on and explain what you guys are working on, because I'm really excited for the future of them. I'm excited to see other clinicians use it as well as other patients. And the last portion of the podcast is called the Health Me to Health You. Typically, the first question I ask is, if you had the attention of everyone in the world for 30 seconds, what would you say? But I suppose because there's two of you, I think the best question to ask here is, I guess, if there's a skeptic in regards to using New Gait, I guess, what would you say to them to perhaps persuade them to use the device?
Prove me wrong. Get a device and listen to your patients. Let them tell you, because it is one thing for me to say it, but it's totally another for you to see it and experience it. So just get it and put it on your patients and see what you find to be the deal with it. And I think you'll be saying that you'll see what we see.
I would say, what do you have to lose? Patient care and being a clinician is all about improving the lives of your patients. And if you have another tool that can do that, what do you have to lose? So I'll just leave it at that.
Love it. Second question for both of you. What book do you recommend, whether book you're reading now or in the past? Each of you maybe just give one or two.
Oh, Amy Cuddy, her book, Presence. And I loved a line from the book that when we feel powerful, we see opportunities. And I loved it so much, I made it into one of those rubberized wristbands to remind me every day that when we feel powerful, we see opportunities.
My book recommendation is The Compound Effect by Darren Hardy. So it teaches us that little tiny improvements every day can compound into greater improvements. And that is true in both business, as Cathy and I know, as well as in recovery for patients. If they're able to just make little improvements every day, that compounds and that gets better and better, as time goes on. And so that's my book recommendation, Compound Effect.
Yeah, I got that book on my list of things to read so far. So I'm anxious to get to that one. I got a couple books ahead of it, but I'm ready to read that one. But last question: where can people learn about what we talked about or learn more from you? I know we discussed the website, but perhaps all links maybe for your guys' LinkedIn or perhaps the website. I guess, where can people find you?
Yeah, so I'll repeat it again. The website, thenewgait.com. They can contact us via email at info@thenewgait.com. And then we're on all social media channels, Instagram, Facebook, LinkedIn, and you guys can find us at The New Gait.
We do have a Facebook, New Gait Clinicians. If someone wants to join, we post stories there. And if you want to find me on LinkedIn, I like to post pretty much daily videos of someone using the New Gait, so you can come and see it in action.
Cathy, Benga, thank you so much for coming on the podcast and sharing your guys' experience and expertise in regards to New Gait.
Thank you,
All
Michael,
right.
for having us.
Thank you for the opportunity.